Hormones are extremely important in every function of our body. In fact, thyroid, our metabolism hormone, has an action on every cell nucleus. Well, what I tell my patients is that your hormones are all in harmony with each other. That means that it's like a symphony. If one of your hormones are off, basically the rest of your hormones will be also off. Almost like if you go to a symphony and the pianist is not playing right, then the music is not going to be as pleasant. So it's really important to address your hormones. And unfortunately, a lot of physicians look at hormones as thyroid is a hormone, and that's it. And they don't really like to address anything besides the thyroid and maybe insulin for those people who are diabetic. But it's a lot more than that. It's your adrenal glands. It's your female and male hormones. It's so much more to it than just those 2 or 3 things that are normally checked. Most doctors just check a TSH and maybe a free T4, and that's it. But those can be completely normal, and these people could have antibodies against their thyroid, and those antibodies could be elevated, causing them to have what's called Hashimoto's thyroiditis, which is a type of autoimmune thyroid disease. And those people, which is about 90% of hypothyroidism is autoimmune, are completely missed. In fact, doctors, mainstream physicians, they basically look at the lab results, and if they're within normal range, they tell the patient, everything is fine, and all those symptoms you just told me, they're in your head. Except for what patients need to realize is that for any hormone to show up in a mainstream medicine lab work, 80% of your gland has to have been compromised. So for your thyroid to show up as abnormal in your lab work, about 80% of your thyroid gland, which looks like a butterfly gland that sits on your neck, has to have been destroyed. And you could have 79% loss, and you can have all symptoms of, I feel depressed for no reason, I'm so fatigued, I'm trying to lose weight and I can't, or I lose weight and gain it right back, I'm constipated, my skin feels dry, I'm losing hair. I mean, you could say all that to your physician, and your physician looks at your thyroid and says everything's fine. But what if you've lost 79 and not 80? It's not going to be fine. So it's best to treat the patient rather than treat the numbers. Numbers are good to support you, but numbers are not everything. And unfortunately, as a mainstream physicians, we've learned to just rely on those lab results and x-rays, not to listen to the patient. So when my patients come and say, Dr. Shaban, I have all these symptoms, A, B, and C, and I'm examining them and I see signs of thyroid deficiency, but their labs are normal, I'm not going to treat their labs. I'm going to work with them. So ask your physician if they're willing to work with you on figuring out and ordering the full panel. And some of them may say yes, even though they don't know what a full panel really entails. So they go with what their training is. But definitely ask your physician if they're not familiar, are they willing to work with a functional medicine doctor that is familiar?